We can all agree that aging often comes with a number of health issues. And the thing is, it's common to see your doctor adding more medications to deal with these health problems. But there is one important thing to keep in mind: the potential risk and side effects of these medications, especially when it comes to our precious memory and cognitive function. Now, imagine this. You have been diligent about taking your medications, trusting that they will help you stay healthy as you enjoy your golden years. But what if I told you that some of those pills that seem harmless could be quietly affecting your memory and cognitive abilities? Well, in this video, I will share with you some common medications that if you are over 65, you should avoid whenever possible due to the increased risk of memory loss. DrJedosaThePharmD here. Welcome, and please like and subscribe to the channel. Number 1. Incontinence and overactive bladder medications. First thing first, incontinence is when you cannot control your pee very well, and overactive bladder means you have to go to the bathroom frequently. Now, your doctor may recommend anticholinergic drugs such as oxybutynin, sulfenacine or vesicare, and toliterodine, just to name a few. These medications are meant to help with these issues, and they're supposed to make your life easier, but they come with a price. And here's the problem. Studies have shown that long-term use of anticholinergic drugs is linked to forgetfulness, brain fog, and mental confusion, especially in older adults aged 65 and older. And I'm sure none of us wants that. But why does this happen? Well, these medications can affect a special messenger in our brains called acetylcholine, which plays a crucial role in memory and learning. So what can you do instead? Well, instead of relying only on these medications, it is encouraging to try some natural and simple changes in your life. For instance, you can start by cutting back on drinks with caffeine and alcohol, especially before bedtime. You can also do exercises such as Kegel exercises, which can help you make your bladder muscles stronger. Number 2. Benzodiazepines. Now, this class of medications is commonly used to treat different conditions, including anxiety, panic disorders, or sleeping problems. Some common names for these medications are alloprazolam, also known as Xanax, clonazepam, and diazepam. You see, when you take benzodiazepines, they do something interesting in your brain. They slow down some important parts of your brain, the ones that help transfer short-term memories into long-term memories. This is important because it's how we remember things for a long time. In fact, taking benzodiazepines has been linked to dementia, especially in older adults. So if you are a senior who takes these medications regularly, it can affect your memory and thinking abilities, which can make your everyday life more challenging. Number 3. Sleep medications. Let me start by saying this. Getting enough sleep is one of the most important things you can do for your health. And when sleep does not come easy for you, your doctor may recommend sleeping medications like Ambien or Zolpidem and Lunesta. But here's the truth. These medications can cause some serious issues, from an increased risk of falling to cognitive problems, which means these drugs can mess with your thinking and memory. And let's not forget about delirium, which is a mental state that can make you feel confused. Now, I know it's not easy, but guess what? Instead of relying on these pills, you may want to try out some natural methods that will not bring along all these troublesome side effects. Creating a bedtime routine, get some exercise during the day, and stay away from screens before bed can all make a big difference. And here's a bonus tip. Other people found their sleep improved by taking safer alternatives like antidepressant medication trazodone or the natural supplement ashwagandha. Number 4. Tricyclic antidepressants. These are older antidepressants such as amitriptyline, nortriptyline, and diazepam. They can help with depression, anxiety, and chronic pain, but they may not be the best choice for seniors. You see, one important thing you should know is that tricyclic antidepressants can have an impact on your memory. That's right. Research has shown that these medications may increase the risk of memory loss, especially in older adults. And that's not something we want for ourselves or our loved ones. Now, how is this possible? Well, it's all about how they work in the brain. You see, they work by blocking important chemical messengers in your brain, serotonin and norepinephrine. So choosing alternative treatments that have a lower risk of affecting your memory is a smart move for those in their golden years. For instance, newer antidepressants like fluoxetine or Prozac and sertraline or Zoloft are usually as safe alternatives for seniors. Number 5. Benadryl and older antihistamines. So here's the deal. Benadryl or diphenhydramine and other older antihistamines like dicyclobenzaprine or Unisom can bring not so great side effects for older adults. They can increase the risk of memory loss, confusion, drowsiness, and blurry vision. You see, many people use these medications for allergies, itching, and to help sleep. But the thing is, these antihistamines can be dangerous for older adults due to their longer half-lives. This means that as you age, they stay in your body for a longer time, so the risk of side effects increases. And they also affect acetylcholine in your brain, which is an important messenger for memory and learning, as mentioned earlier. And here's something important to keep in mind. Benadryl and other older antihistamines can also be hiding in other medications you may not think of, like Advil PM or Tylenol PM. So what are my options for allergies? Well, the newer antihistamines like loratadine or Claritin have been shown not to cause memory loss in seniors. So here's the bottom line. We all know that memory is like a treasure chest full of precious moments, experiences, and knowledge. It's what makes us who we are. However, older age can come with many health challenges that may require taking different medications. But the problem is that some of the medications recommended by our trusted doctors can potentially cause unwanted side effects, including memory loss. So if you or someone you care about is over 65, please consider avoiding these medications if you want to keep your memory sharp and your golden years full of unforgettable moments. And also remember this, the medications we have covered in this video are not the only ones that need your special attention. There are more medications to be mindful of, like antipsychotics, seizure medications, Paroxetine, which is an antidepressant, muscle relaxers such as cyclobenzaprine, and motion sickness drugs like Meclizine or Promethazine. And there you have it. Remember, knowledge is the key that unlocks the doors to a healthier and happier you. Thanks for watching.